So let's start with Canadian Consul General Joe Comartin, who's calling in from Detroit. How you doing today, Joe?
I'm doing fine, Mike. Thank you.
All right, so we're going to talk a little bit about what you folks in Canada have been doing. And so how has the Canadian government responded to the need for personal protective equipment and other essential materials for the COVID-19 response?
Well, we've done a number of things, Mike, in terms of ramping up our own production to get sufficient access to PPEs. We think we've pretty well got that stabilized, both in terms of what we're producing locally in Canada, domestically in Canada, but also the outreach that we've made to a number of other countries, the United States in particular, to provide sufficient supplies.
All right. And so how big is the industry? I mean, the Canadian response, you're like what we've done here in Michigan and across the states, where a lot of industries that don't traditionally produce PPEs, personal protective equipment for the healthcare industry, have pivoted into doing that. So what has been the Canadian industry's response on that?
It's been very, very similar to what it has been in the U.S. I'll play a bit of loyalty to my country and think we've done it pretty well, but clearly so has the United States. That pivoting that went on in a very short period of time was quite amazing. Any number of instances just in the local area, in the Windsor, Essex County area right here beside Detroit. A local distillery, for instance, has begun producing not alcohol, but sanitizers, which mostly they've been donating. A number of companies have been working specifically on ventilators. Others have been working on masks and shields. Ford Motor Company, for instance, locally has been producing for over 2 months now face shields, which have been used extensively, and quite frankly, a good deal of which has been donated.
All right. So you talked about what things are being made. Let's talk a little bit about were there really innovative products that have been developed to battle COVID-19?
Well, I think the ones that are probably the most interesting that we've been working on in conjunction, again, with some of the companies in the United States have been to move not entirely away from production of original masks, but to sterilize them. And a number of companies on both sides of the border have been doing this quite effectively. It's allowed us to move substantially up the number of masks that are available to our service providers. So that's been one interesting one. I think the other one that I would note is the material for some of these masks that are produced in British Columbia, a small company out there, within I think a few days of the pandemic hitting and them recognizing the greater demand we were going to have for this material to make the surgical masks. They ramped up their production. They doubled their production almost overnight. That's been very effective in meeting the demands on both sides of the border. And we are a big supplier of that material to the U.S. side.
Okay, so how are all these PPEs and whatnot, how are they being distributed? Did you hear me?
Well, Canada has the advantage of having a national healthcare program. Although it's administered province by province. We have 10 provinces and 3 territories. So it's administered through those. But the coordination that has gone on at the national level has provided real leadership. They've also been enabled by it being done nationally for us to do purchases on the international market that would have been very difficult for individual provinces to do. So that's the source of it. It has been coming, if it's coming from outside the country, has been coordinated at the national level with our federal Department of Health, and then distributed to the provinces on an as-need basis.
All right. So what I know the U.S. government has been doing some financial incentives and whatnot, doing other things to help industry do this pivot. What has the Canadian government done specifically to help industry produce PPEs, things like that?
Well, I think not so much looking directly at that, although again, we coordinated a number of efforts to make sure that companies were cooperating with each other. And in fact, a private group has gotten together with some support from the federal government to make the supplier of the material and the person who's actually building the product. We've been having, I think we've had over 1,000 relationships that have been built up during the last 3 months to make those the efficiency of the operations to be as strong as we possibly can. So the government has certainly supported that. The government, and then in addition to that, beyond just the provisions they've made for companies working with health products, health items, have been providing large-scale support for wages, both directly to people who are out of work and to companies, so that we are, in effect, subsidizing wages for companies that are continuing to function during this period of time. And then in addition to that, there are very substantial direct loans or direct grants to corporations to the extent that they need in order to keep operating.
Kind of looking at the situation, why don't we go to that map, Dave, and show the map of Canada and talk about what's going on?
Yeah,
All
so
right,
you can
go
see
ahead.
there,
Yes.
Mike, that the concentration is in our two largest provinces, both in terms of geography and in terms of population. Um, we've had some serious discrepancies in the rate of the pandemic hitting, the virus hitting. It's been much lower percentage-wise on the East Coast and the West Coast, and actually through the center of the country and the prairies. The biggest concentration in terms of percentages and in terms of absolute numbers are in the two largest provinces of Ontario and Quebec. Quebec has unfortunately had the greatest number of fatalities, quite disproportionate to their population if you compare it with the rest of the country. But I think the point that we're now seeing is that we not only feel that we've plateaued that proverbial curve that we talk about, but we've actually turned it down, and we're seeing a substantial reduction in new cases, substantial reduction in fatalities. We do have some hot spots. One right here in the local area outside of Windsor. We have a large number of migrant farm workers who come in from Mexico and the Caribbean. That's an annual event to work in the agricultural sector. And we've had very high rates of incidence of them contracting the illness. Fortunately, so far we've only had 3 deaths within that community, but it's one that we're very, very concerned about. On the other hand, we go across the country with very few exceptions. We've eliminated all the hot spots. And as I've said earlier, the numbers are dropping quite dramatically.
Yeah, it looks like the Yukon Territories is doing quite well, right?
Well, again, you've got a very small population up in the territories, right? But they are proud of the fact that they've had absolutely no cases. They've been very rigid about watching their own people and protecting them. Vast discouragement of letting people come into the territory has been one of the mechanisms they've used, as have a number of the other territories and provinces, but they've been the most successful by far.
Yes. Well, let's talk a little bit about the border crossing. As you know, some 400,000 people pre-pandemic were crossing the border on a daily basis. And then obviously the prime minister instituted some restrictions. I think the U.S. instituted some restrictions. Where does all that stand right now?
Well, the restrictions are mutual. We were very clear right from the beginning, and I know there were some negotiations that went on about them being even more severe than they are. But from the very beginning, we imposed restrictions that of nobody being able to cross, and then put in exemptions. The 2 most noticeable ones were for people providing medical services. We have a large number of people right at this border crossing who come from the Canadian side into the U.S. Health system, providing direct health care. So they were been allowed to continue with no restrictions. The other big area was to make sure that the shipping of goods, health goods in particular, were not in peril, but the whole trucking industry, that proverbial supply chain that we talk about, has not been interfered with. It's worked very smoothly on an ongoing basis. Now, obviously, the numbers in that area are down dramatically, or were down dramatically. They're building back up as the auto industry and manufacturing opens up again. But while they were down, whatever product was needed, in fact, did move back and forth across the border. The only other thing that maybe differentiates between the Canadian and the American side is that earlier this month, our Prime Minister granted an additional exemption to allow families to reunify. Mike, you know this area quite well, so you know that there's lots of Canadians who are married to Americans on one side or other of the border, and vice versa, Americans who are married or living in a common law relationship on the other side of the border. So they've been allowed to now cross over when they weren't before, but they do have to self-isolate for 14 days.
Okay. We're almost out of time now. Are any of these restrictions going to be changed at all in the near term here, or are they going to remain in place?
We've been negotiating with the United States on to renew these on a monthly basis. So it'll be coming up for renewal again in the 21st of July. It was just renewed on the 21st of June. I know there are negotiations going on to perhaps provide some additional exemptions, but none that are clear at this point. I think there's a general consensus that the exemptions at least are going to be renewed, but that the prohibitions and restrictions are going to continue on with maybe some minor modifications.
Traditional four-year students love Lawrence Technological University's thriving campus life, but LTU has always met non-traditional students' needs too. Lawrence Tech offers over 100 degree and certificate programs that can get adult students started or back on track. And most of our classes are conveniently offered evenings at our beautiful Southfield campus or online, so you can balance your social, family, and work life even while you power up your career. Lawrence Tech, where Blue Devils dare.